Ever notice how ads always pop up at the worst moments? When the killer's identity is about to be revealed. During that perfect meditation flow. On Amazon Music, we believe in keeping you in the moment. That's why we've got millions of ad-free podcast episodes, so you can stay completely immersed in every story, every reveal, every breath. Download the Amazon Music app and start listening to your favorite podcasts ad-free, included with Prime.
The American dream. It's a phrase that's just loaded with promise, isn't it?
Absolutely. It's this implicit contract that if you work hard, if you contribute, you'll get stability. You'll own a home, have a secure retirement.
It was supposed to be the roadmap, the clear path for participating in the U.S. economy.
But today, for so many people, that roadmap feels less like a promise and, frankly, more like a cruel illusion.
Yeah.
We are really at an economic tipping point, and it's not because people have stopped working hard. It's because the unavoidable mandatory costs of just participating in modern life they've just metastasized.
The tickets you need just to hold a job, run a family, stay healthy.
Exactly. They've grown beyond the reach of what a median income can actually support.
We're calling this the participation tax. It's this silent structural expense that just makes the math of working hard fundamentally unsustainable for huge numbers of people. Okay, so let's unpack this. Our sources today are digging deep into why you might feel poorer even when the official economic numbers look healthy.
And why the faster you run on that financial treadmill, the more likely you are to actually fall behind.
We've synthesized a lot of research for this, covering everything from these totally outdated poverty metrics to the reality of what a household budget actually looks like today.
All the way to the rise of algorithmic pricing, corporate opportunism, and the structural failures that are really underpinning the housing and healthcare crises.
So our mission here is to connect all these data points and show how this is about system decay, not moral decay. It's about how the struggle to afford basic life has become this constant state of precarity.
And as we go through this, I think it's important for you to keep one idea in mind. It's an acronym, POSIWID.
POSIWID.
The purpose of a system is what it does.
Right.
So if the stated purpose of the American system is upward mobility, but the actual outcome is financial entrapment for the majority, then the system, by its actions, is fundamentally broken.
So let's start with the ruler itself, because if you're measuring the true cost of survival with a broken metric, you are always going to get a broken policy answer. I want to start with a fact that is, to me, just mind-boggling. The official way the U.S. measures poverty is based on a formula from 1963.
It's a historical relic. It's completely, fundamentally out of sync with the economic reality of 2024.
So who came up with it? How did it even work?
It was created by an economist named Molly Orshansky. And her method was, it was pretty pragmatic for the time. She looked around and saw that families generally spent about 1/3 of their income on groceries.
Okay, that makes some sense for the 60s.
Right. So she figured if you can calculate the cost of a minimum adequate food budget, just the bare floor for survival, you could multiply it by 3, and voila, you have a poverty line.
So it was always just a rough estimate, a heuristic.
Exactly. And crucially, Orshansky herself stressed that she was drawing a floor. She was measuring income inadequacy, the line below which a family was clearly in crisis.
Non-income adequacy.
No, not at all. She's measuring who had too little, not who had enough.
And that 3x multiplier only worked because of what other costs looked like back then.
Precisely. The other costs were either heavily subsidized or they just weren't mandatory market costs in the same way. I mean, think about it. In 1963, housing was cheap relative to income. Healthcare was low cost. Blue Cross family coverage was about $10 a month.
$10? What's that today?
Adjusted for inflation, it's only about $115, a fraction of what people pay now.
And things like childcare.
Often not a market expense. The economy could still support a single-earner household, or you had family and community support networks.
You could pay for college with a summer job.
You could. And retirement meant a pension, a defined benefit. You didn't have the burden of funding your own 401k. The non-food costs were they were relatively flat and manageable.
Okay, so fast forward to 2024.
And the whole picture is just unrecognizable. The formula is broken because the core input food spending has completely collapsed relative to everything else.
And the mandatory costs, the participation tax items, they've exploded.
They've exploded. Can I quantify that for you?
Please.
For most families today, food you eat at home accounts for a mere 5 to 7% of the total household budget.
5 to 7%. down from a third.
Exactly. The spending surge has happened in these complex, mandatory, policy-driven categories. Housing now eats up between 35 and 45% of a budget.
Wow.
Healthcare, 15 to 25%. And childcare. For families with young kids, childcare can consume a staggering 20 to 40% of their income just to allow both parents to go to work.
So if we stick with Orshansky's original logic,
Mm-hmm.
that the poverty line should be based on the inverse of food share of the budget.
Then the math changes completely.
If we take food share as, say, 6.25%, that's 1/16 of the budget, the multiplier isn't 3 anymore.
It's 16.
16.
And the implications of that are just profound.
So what does that do to the poverty line number?
Well, if you calculated it today using that 16x multiplier, the crisis threshold for a family of 4 wouldn't be the official 2024 line of $31,200.
It would be.
It would land somewhere between $130,000 and $150,000.
$150,000.
As the poverty line.
As the crisis threshold. And when you compare that true threshold to the current official line, it tells you one thing.
What's that?
The current measure is, frankly, measuring starvation. It's an obsolete benchmark that is quietly sanctioning deep, unacknowledged precarity for millions.
So to make this more concrete, one of our sources actually did the math. They calculated a conservative basic needs budget for a family of 4, 2 earners, 2 kids.
And they landed on a required gross income of $136,500.
And that's just to cover the basics.
Just the basics without relying on any means-tested benefits. And when you look at that budget line by line, you see the scale of the participation tax.
The single largest item.
Childcare, $32,773 per year.
That's more than the entire official poverty line for that family. By $1,000, yes. And this budget, it doesn't allow for savings or retirement or even much discretionary spending. It is merely the cost of staying solvent.
And the housing number in that budget, about $1,900 a month, that felt pretty low for a lot of the country.
It is low, and they stress-tested it. They pointed to a real-world example in Caldwell, New Jersey, a modest commuter town.
Right.
Today, the cheapest 2-bedroom rental you can find there is $2,715 a month.
That's nearly $800 a month more than the conservative budget assumes.
Which is another $9,300 a year in after-tax money. So to cover that reality, the family would need an extra $12,000 or $13,000 in gross salary.
Pushing that minimum threshold past $160,000.
Instantly. And this is critical. That $136,000 figure is a conservative floor. The policy implications of using a $31,000 poverty line when the real floor is closer to $140,000 are just. They're profound.
So if $140,000 is the real floor, that must mean there's a huge political incentive to keep the official line low. What's dependent on that broken number?
So many programs. Means-tested relief like SNFP, housing assistance, energy assistance. They all use the official poverty line, or a slight multiple of it, as their eligibility cutoff.
So by keeping the line artificially low,
The government dramatically limits its financial obligation and the number of people who can get aid. If you truthfully raise that line to $140,000, half the country would qualify for some form of assistance.
which would force a complete rethink of the entire welfare state and the tax system.
A complete restructuring, yes.
And meanwhile, the median household income in the U.S. is what, around $80,000?
Roughly, yeah.
Under these new calculations, that $80,000 family isn't middle class anymore. They are functionally living in deep structural poverty.
We have to redefine them as the working poor. They earn enough to be told they're solvent, but they don't earn enough to cover the mandatory costs of being an employed family in America today.
They're trapped.
They're trapped in the mathematical gap created by outdated metrics and skyrocketing mandatory costs.
And we see this confirmed in other data, right? Using metrics like the true cost of economic security or TCES.
Right. TCES is a metric that tries to quantify the income a family needs to meet basic needs without relying on public or private assistance.
Using real market rates for everything.
Exactly. And the finding is alarming. In 2022, 52% of all people lived in families below that TCES threshold. It confirms the struggle is widespread. It defines the lives of most Americans now.
So the math shows survival is expensive. But why does the market keep finding new ways to make participation itself more expensive? Which brings us to the specific non-negotiable costs of this participation tax.
Right. The price of admission to the modern economy now has this non-negotiable digital component. You really cannot just opt out of being connected.
To get a job, apply for a job, out your taxes, manage your bank account.
Interact with your kids' school, healthcare portals. It's all online. Digital tools are mandatory.
So that means a functional smartphone, reliable high-speed internet, various subscriptions. These are absolute necessities now.
And if you don't have them, you're not just disconnected from social life, you are fundamentally disconnected from economic opportunity and employment.
And all that can quietly add up. A family could be spending over $200 a month just on that connectivity.
Which is a significant mandatory layer added to the burden. This connectivity is, like you said, a new kind of tax. The utility you're buying is access to the economy, and the price has inflated massively.
And that inflation is probably most visible in healthcare. It's the largest mandatory cost outside of housing. That 14x inflation-adjusted increase since 1955 is just... it's devastating.
It's a structural crisis. The average family premium is now over $1,600 a month. But the cost doesn't stop there. Deductibles, out-of-pocket maximums have all soared.
Which is why almost half of U.S. adults, 44%, find it difficult to afford their healthcare costs.
So what happens when that family trying to make it on, say, $80,000 a year has to choose between their health and their solvency?
They put it off. They defer care.
About a third of adults, 36%, say they skipped or postponed needed medical care in the last year because of the cost.
And for uninsured adults, that number jumps to 75%.
It's a public health crisis that's masquerading as a personal finance issue.
And the choices people are making with prescriptions are even more dire. We're talking about literal life and death financial negotiations.
Yes. About 1 in 5 adults didn't fill a prescription due to cost. And even more concerning, 1 in 7 adults admitted to cutting pills in half or skipping doses of medicine because they couldn't afford the full regimen.
They are actively risking their health to make their budget balance.
And the financial consequences of this just permeate their entire economic life. Medical debt becomes generalized debt.
So it's not just a bill from the doctor's office.
No. In 2022, 41% of adults reported having debt from medical or dental bills. That's debt on credit cards, debt in collections, debt to family and friends. It just erodes their ability to save, to contribute to retirement, to buy a home.
It really highlights the fragility of the whole population. That finding that about half of all U.S. adults say they couldn't pay an unexpected $500 medical bill out of pocket it's maybe the most damning statistic of all.
It is the math of perpetual precarity. It means the American middle class is one flu diagnosis, one car accident, one high deductible away from financial ruin.
Stability is an illusion.
For a majority of the country, yes.
Okay, let's touch on the last piece of this. Utility costs, the other unavoidable fixed cost, also spiking dramatically.
They are. The average is now $265 a month, up 12% just since last year. And this isn't just a cycle, it's structural.
No.
Over 124 million Americans are expected to see rate increases in 2025.
And the drivers are things like upgrading aging infrastructure, which is necessary, but also the massive energy demands from new AI data centers.
That's a really important connection to make. The energy needs of AI are substantial, and they're forcing huge utility investments that get passed directly down to the ratepayer.
And that burden is inherently regressive.
It is. The delivery charge, that fixed cost on your bill, is unavoidable. So low and middle income families bear the burden most acutely. They spend 6 to 10% of their income on energy, which is 3 to 5 times more than high-income households.
It's just another drain on the working poor.
And it accelerates that drain.
Yeah.
The mandatory costs are soaring, and the way prices are set in the modern digital economy, well, that just compounds the problem. It creates opacity and an unpredictability for anyone trying to budget for that $140,000 threshold.
Right, and here's where we really need to distinguish between dynamic pricing and the more concerning personalized or surveillance pricing.
Okay, so dynamic pricing is basically a market reaction. It responds to supply and demand, competitor prices, and it raises prices for everyone who's buying at that moment.
Like Uber surge pricing.
Exactly. Personalized pricing, though, is individual extraction. AI uses vast amounts of your personal data browsing history, purchase habits, your location, your device, to create a specific profile of you and predict your individual willingness to pay.
So if the algorithm predicts that based on my zip code and the fact that I only shop for flights on a weekend, and willing to pay $400 for a ticket.
But the person next to you, who has a history of comparing prices for weeks, will only pay $350.
We will see different prices.
You'll see different prices for the same product at the same time. The system is designed to maximize revenue from every single customer.
We saw this with Instacart, right?
Yeah.
Where 75% of products had different prices.
That Instacart finding is particularly worrying. Prices varied by up to 23%. So how can a family on that tight budget plan accurately when the price of basic groceries is determined by an algorithm that thinks it knows their financial desperation?
It completely undermines budgeting.
Completely. And the ethical risks here are huge. Let's start with fairness. If these algorithms are using proxies for income, like your device type or where you live, they can unintentionally or even intentionally discriminate.
Deepening existing economic disparities, funneling the highest prices to the neediest people.
And that just creates alienation. You feel cheated when you find out someone else paid less. Your trust in the retailer just evaporates.
So moving to the macro level, this brings us to the whole greedflation debate. Is this price surge we've seen legitimate inflation, or is it corporate extraction?
The extraction argument, what some call seller's inflation, is very powerful. The critics argue that large corporations use the chaos of the pandemic and the war in Ukraine to raise prices far beyond what was needed to cover their own costs.
They were just padding their profit margins.
That's the argument, and fast food is a great example of this.
Right, the normalization of the $3 burger.
Exactly. Chains like McDonald's and Chipotle raised prices by 40 and 35% between 2019 and 2023. And those prices never came back down.
So what was once a cheap, necessary safety net meal for a low-income worker is now a discretionary luxury.
And in some communities where grocery stores are scarce, this is a direct, normalized price gouge on basic caloric intake.
But the sources also provided some counter-evidence here, right? It's not always so clear-cut.
That's essential for an impartial analysis. The data for food and beverage stores in the first half of 2024 showed that in some cases, output prices rose at the same pace as their input prices.
Meaning they were just passing along their own rising costs from commodities and transportation.
It suggests that, at least for some segments, the economic reality is probably a mix of legitimate cost pass-through and opportunistic extraction.
But regardless of the cause, consumers are clearly hitting their limit.
That pushback is now a dominant economic force. People are fighting back. They're shifting to store brands. They're flocking to discount stores like Aldi. They're just buying fewer items.
And this resistance has been so effective that even large food companies are being forced to slow their price increases. The market is demanding affordability.
This whole debate over cost versus extraction has really prompted a legislative response because the current patchwork of state laws is just not equipped to handle this.
Which brings us to the proposed Price Gouging Prevention Act of 2024 in Congress. It's trying to create a uniform federal standard.
It is. The act makes it unlawful to sell a good or service at a grossly excessive price. But the key mechanism is what's called a presumptive violation.
Okay, what does that mean?
A company is presumed to be in violation if, during an exceptional market shock, like a natural disaster or a supply chain disruption, they sell something at an excessive price compared to the period before the shock, and they have what's called unfair leverage.
And unfair leverage is defined in a way that targets the biggest players.
Precisely. It's defined as earning over $1 billion in revenue or holding a significant market share, 40% as a seller, 30% as a buyer. It forces them to justify their price hikes during a crisis.
And there's a defense, right? They can argue their costs went up.
Yes, an affirmative defense. If they can show with clear and convincing evidence that the price increase is directly and solely because of costs outside their control, they can rebut the presumption. It puts the burden of proof on them.
Which is where more transparency comes in.
Exactly. The act would also mandate increased SEC disclosures, forcing companies to explain their pricing strategies and gross margins during these shocks. It would give regulators the data to tell the difference between cost pass-through and extraction.
All these pressures, the high mandatory costs, the opaque pricing, the extraction, are creating these structural barriers to getting ahead. It's hollowing out the middle class.
And it's trapping people in what some call the affordability cliff or the valley of death.
This is the idea that you're punished for earning slightly more money.
It is the math of disincentive. A family gets a modest raise, and that slight income increase triggers the abrupt loss of essential benefits, Medicaid, SNAP, critical childcare subsidies.
And it leaves them financially worse off than they were before the raise.
Often, yes. Let's look at the math on healthcare. A $10,000 raise can trigger the loss of Medicaid eligibility.
Okay.
Replacing that subsidized coverage with a decent market plan can easily cost that family $10,567 a year.
So they got a $10,000 raise and their costs went up by more than $10,000. They lost money.
They paid to lose $500. It's an effective tax on their effort of over 100%.
And the childcare subsidy trap is even worse.
It's catastrophic.
Right.
A small raise can push a family off that subsidy cliff, forcing them to replace a small copay with the full market rate of, say, $32,000 a year.
So what's the rational response to that?
For many, the only rational response is for one parent, usually the mother, to leave the workforce. The cost of working literally outweighs the value of the raise.
The conclusion is just stark. A family earning $100,000 can easily be in a worse financial position than a family earning $40,000.
Exactly. At the bottom, the state provides a floor of necessities. In the middle, the state declares you're on your own and hits you with the full market price for things you need to hold down your job. The system confiscates 70 to 100 cents of every dollar of effort on that climb.
This forces us to completely redefine what success even looks like. We see these charts celebrating the shrinking middle class, with the idea that more families are moving up into the $150,000 plus bracket.
But if we look at that chart through the lens of the real $140,000 crisis threshold,
then that top tier isn't the upper class.
it's the new survival line. And the true middle class, those earning between $50,000 and $150,000, are effectively the working poor. They're trapped in that valley of death, earning enough to pay taxes and lose benefits, but not enough to actually achieve stability.
And this makes long-term wealth building, especially for retirement, seem almost impossible.
The numbers are grim. 1 in 5 Americans aged 50 and over report having no retirement savings at all.
None.
0. And again, this links back to a structural problem of access.
Right.
Nearly 57 million people don't have access to a workplace savings plan. And we know that Americans are 15 times more likely to save when a plan is available through their employer.
Without that easy on-ramp, any extra money they might have gets eaten by high-interest debt.
Credit card debt, specifically. Often servicing 25% interest just to cover the gaps. You cannot build a secure future while servicing debt at that rate. It's a wealth destruction engine.
And we have to emphasize, this affordability crisis is pervasive. It's not a red state or blue state thing. It affects everyone, everywhere.
The data is very clear on that. 1/3 of middle-class families nationwide struggle to afford basic necessities.
Yeah.
And the issue is compounded by racial disparities. 50% of Latino or Hispanic middle-class families and 39% of Black middle-class families can't afford the basics.
And it's true in every city.
In all 160 U.S. metro areas they studied, at least 20% of the middle class cannot afford to live there. It is a system-wide failure.
When we talk about precarity, the single biggest driver is housing. Research shows it correlates more closely with homelessness than anything else. High housing costs are what push people into crisis.
And the entry barrier for stability has never been higher. The median age of a first-time home buyer is now 40. And to afford a typical home today, you need an income of $121,000.
Which is $37,000 more than the average American earns. The path is blocked.
It is. And a huge part of the problem is that the entire bottom rung of the housing ladder, the thing that once let low-income workers stabilize and save, has been systematically eliminated.
You're talking about the single-room occupancy unit, the SRO.
Exactly. SROs were micro units. Small rooms, shared bathrooms, sometimes a shared kitchen. They were the reliable, low-cost option. Historically, they were incredibly cheap, costing as little as $100 to $300 a month in today's dollars.
And these weren't just some marginal thing. They were a significant part of the housing stock.
A huge part. They made up about 10% of all rental units in some major cities by 1950. They were functional, they provided a path to stability, and they were profitable for landlords.
So what happened to them?
Policy changed radically. Starting in the mid-50s, cities, driven by this negative view of SROs and their residents, just revised their zoning and building codes
To get rid of them.
to effectively ban them. New rules mandated minimum unit sizes, required private bathrooms. It made new SROs impossible to build and made existing ones illegal.
So this was a deliberate policy choice to eliminate affordable housing.
It was, and it was highly effective. Between 1970 and 1980 alone, an estimated 1 million residential hotel rooms were destroyed or converted, almost all because of new laws, not market forces.
And the link between that SRO loss and the rise of homelessness is undeniable.
It's a direct correlation. Homelessness was actually rare from the Depression until the late 70s. As the SROs disappeared, homelessness exploded nationwide.
People had nowhere to go.
Exactly. In New York City, half the men entering shelters in 1980 said they had previously lived in SROs. We took away the lowest rung on the ladder and left people with nothing.
And the numbers today, they really confirm that this is the missing key.
They do, and this is the critical structural finding.
Yeah.
If the SRO stock had merely grown since 1960 at the same rate as the overall U.S. housing stock, the nation would have 2.5 million more low-cost units today.
2.5 million.
More than triple the total number of people counted as homeless in 2024. The housing crisis is a direct policy-induced failure of supply.
But there is some renewed interest in bringing this model back, right?
Thankfully, yes. States like Washington, Oregon, Colorado are passing laws to remove the local legal barriers to building SRO-type housing. They're trying to fix the policy that broke the market in the first place.
And the opportunity to convert vacant office space seems huge.
It is. Office-to-residential conversions can create these SRO-style micro-units for about half the cost of new construction. The rents could be half the median, making them affordable to people earning 30 to 50% of the area median income.
Exactly. The population trapped below that $140,000 survival line.
Precisely.
So the crisis is systemic decay, driven by mandatory costs in broken markets. What levers can policy actually pull to reverse this participation tax?
You have to tackle the three largest broken markets: housing, healthcare, and childcare. In healthcare, the U.S. needs meaningful national efforts to hold down costs, not just subsidize them.
And the structural flaw remains that tax exclusion for employer-sponsored insurance.
Correct. It reduces the incentive for employers to demand low-cost plans. And while capping drug costs is great for immediate relief, that's less than 10% of overall health spending. You have to fix the core financing structure.
Same for childcare, which is a financial black hole for families.
It's temporary, but ruinous. We need to start treating childcare as essential economic infrastructure. Publicly financed universal childcare, like some states are exploring, boosts stability and labor force participation at the same time.
And beyond these core markets, there's macro trade policy, which is quietly taxing every American consumer.
We're talking about tariffs. The current regime is effectively slapping a massive $140 billion regressive sales tax on consumer goods.
And the critical point is that these costs are borne by U.S. consumers, not foreign producers.
Precisely. They boost consumer prices by 1 to 1.5%. That directly hits the purchasing power of that median $80,000 family. It's a policy choice that just makes everything more expensive.
So if the goal is immediate relief, getting rid of tariffs is one of the clearest paths.
It is. Removing the existing creed measures could put roughly $1,800 a year back into consumers' pockets. It's an immediate boost to purchasing power for every working family.
But politicians face what you call the affordability conundrum. Voters want instant relief, but these durable structural fixes take years.
So the immediate critical steps have to be about preventing things from getting catastrophically worse.
Like preventing the expiration of the ACA health insurance subsidies.
Yes. Letting those expire would cost 22 million Americans an average of $1,000 more a year. It would push millions deeper into that valley of death.
And there is overwhelming bipartisan support for these bigger structural policies, isn't there?
There is. Policies like increasing Social Security benefits by raising taxes on high earners, or investing in building more housing, or raising the minimum wage. The public understands the need for systemic solutions. They get the root cause, the gap between what life costs and what work pays.
So to bring this full circle, that feeling you have of running on a treadmill that just speeds up the harder you try, it's not a personal failure. It is a function of broken policy metrics that measure starvation, coupled with AI-driven extraction and structural decay in mandatory markets like housing and healthcare. The value of your raise is often entirely erased by the cost of keeping your job and staying alive.
The core findings here really speak to a profound systemic failure. We've documented this $140,000 survival line that redefines the middle class as the working poor.
The 2.5 million missing SRO units that directly correlate with modern homelessness.
And the structural valley of death that imposes an effective 70 to 100% tax on upward mobility. The system we are in is unsustainable.
If the purpose of a system is what it does, Possibly. And the current system traps the middle class, penalizes participation, and makes life unaffordable even for those earning the median income, then the system is fundamentally broken. We have to acknowledge its primary outcome is financial instability for the majority. So the question we leave you with is not whether the American dream has vanished, but what new functional system is required to replace the broken one we are currently trapped inside.
Thank you for joining us for this deep dive into the true price of the American dream. We hope this has given you something substantial to analyze and explore further on your own.
Until next time.